Hi, good morning, everyone. Before the meeting begins, I will allow our interpreter to introduce themselves and provide instructions for interpretation.
Good morning. Announcement from the interpreter. To use the interpretation feature, please scroll to the bottom of the Zoom screen where the meeting controls are. Click on the interpretation icon, the world, and select English as your language. If you're joining through the Zoom mobile app from a cell phone, tablet, etc., please press the ellipsis, then interpretation, and then choose your language. Finally, click on mute original audio to not hear the original Spanish low in the background. Headsets are available for interpretation. If you are in the meeting room, please check out a headset from the receptionist in the lobby. Aviso por parte del intérprete. Para hacer uso del servicio de interpretación, favor de desplazarse en la parte inferior de la pantalla de Zoom, donde aparecen los controles, haga clic en el icono de interpretación, el globo terráqueo, y seleccione español. Si está usando la aplicación móvil de Zoom desde su celular, tableta, etc., presione los puntos suspensivos, luego interpretación y luego el idioma. Si no desea escuchar el audio original en inglés en el fondo, por favor seleccione silenciar audio original. Contamos con auriculares disponibles para el servicio de interpretación. Si se encuentra en la sala de la reunión, por favor de pedir auriculares con la recepcionista en el vestíbulo. Gracias. Thank you.
Thank you. Welcome to the May 21st of 2024 SSTAC meeting. I'm your chair, Alex Warner. Can we have our clerk, Tessa, please confirm quorum with roll call?
Thank you. Good morning. Special interest voting member seat A, Wayne Landon.
Here.
Special interest voting member seat B, Sharon Beckus.
Present.
At-large voting member seat A, David Jackson.
Here.
And Todd Shaw. At-large voting member seat B, Todd Lordson.
Here.
And Marissa Romero Lutero.
Here.
At-large voting member seat C, Chair Warner.
Oh, here.
San Diego Center for the Blind is absent. Travelers Aid Society of San Diego, Marcy Rourke.
Here.
Options for All and the Arc of San Diego are absent. Jewish Family Services, Christine Stensberg. Marilyn Greenblatt. Fact Seat A is absent. Fact Seat B, Sophia Hughes. MTS Fixed Route is absent. MTS Paratransit, Charles, I'm sorry, I can't read your name. Pasapel. Okay. And Bree Graham. In NCTD Fixed Route, Mary Balderrama. NCTD Paratransit is absent. That concludes the roll call and confirms a quorum.
Thank you, Tessa. To participate at the meeting, members of the committee may raise their hands and will call on you by name. Members of the public may participate both in person and online. In-person public commenters, please submit a speaker slip to the clerk. Online public commenters will use the raise hand function in Zoom. With that, we can begin our agenda, starting with item 1, which includes public comments, member comments, and staff update. Are there any non-agenda public comments?
I have no non-agenda public comments.
Thank you. Do any members have comments not related to today's agenda items? Sharon.
Yes, I just wanted to say thanks to MTS and customer service availability. I just was in Seattle and spent 12 days using public transit, and they do not have any customer support in the PM or on Saturdays and Sundays. So it's really useful to have you guys, and I'd like to thank you for being open on Saturdays and Sundays as well.
Any other comments? I don't see any other hands up. Thank you, Sharon, for your good comments. Thank you. As part of this item, we will hear a SANDAG staff update from Ashley. Thank you, Ashley, for being here for us.
Hi, how are y'all? So staff are finalizing a transit fare discount study with recommendations on improving transit services and targeting fare relief to those who need it. We're also continuing study opportunities for transit-oriented development at the Blue Line stations, as STAC heard about earlier this year, as well as improvements to the transit service and pedestrian connectivity at the San Ysidro Mobility Hub Transit Center. We are also working on starting new rapid routes. We're going to be planning for 6 routes that will serve every portion of the county, including South Bay, Central San Diego, Carlsbad, San Marcos, El Cajon, and Ramona. And more information will be to follow on those. Thank you.
Do any members have comments or questions on the SANDAG staff update? I don't see anyone. Seeing no further comments, we will continue to the next item, which is our consent agenda. On the consent agenda today, we have the minutes from our March meeting. Are there any public comments on the consent agenda?
I have no public comments on consent agenda.
Thank you, Tessa. Seeing none, are there any comments or questions from the members? If not, no comments from the members. If not, I'll ask for a motion to approve the consent agenda. Mary,
I motion to approve the minutes.
is there a second? Christine, second. Will the clerk please take the vote?
And did you want me to do a roll call vote, or they can just raise their hands?
Raise hands.
Yes, there's anyone that for ayes, please raise your hands. Anyone knows?
I
Or
don't see any no's.
abstentions? I'm sorry, Chair.
No, I didn't see any.
Okay, then that motion passes unanimously.
Thank you, clerk. Thank you. We will now move to the next item. Our item 3, we will hear from Sam Sanford, a senior regional planner at SANDAG, with an update on the regional safety planning.
Good morning, everyone, and thank you, Chair and working group members, for having us back again today. I think the last time myself, Sam Sanford, and my colleague Jacqueline Sisk were here was September of 2023, when we were kicking off this project to set up a regional, essentially traffic or transportation safety plan. And this really stemmed from an item that we come to this group on often, which is target setting, annual target setting for safety performance, and then other performance management factors led the agency to initiate this process to develop a regional across the entire county in the 18 cities and 17 federally recognized tribes to have one safety plan that helps guide them at a large scale. So we wanted to come today with some updates on this planning effort. And with that, I will kick it over to Jacqueline to lead us off.
Good morning, everyone. In today's presentation, we're going to quickly go over some background and overview and talk through some efforts that have been completed to date on public engagement. And then we will review draft summary statistics and see how we're doing in safety in our region. And we'll talk about the challenges of traffic safety and look at some data products that have been developed with this effort. We'll get into the Safety Focus Network and the Draft Systemic Safety Network and discuss next steps. The Regional Vision Zero Action Plan is a combination of projects, policies, and programs. It's aimed to equip local jurisdictions to advance safety across the region. Some jurisdictions are doing a great job in leading this effort, and other jurisdictions have not. And this effort that we're creating is designed to help identify locations and safety solutions or safety projects that jurisdictions can then apply for federal funding to advance their programming efforts. 3 years ago, the U.S. Department of Transportation announced a new funding source called Safe Streets and Roads for All. This funding source is $1 billion, at least for 5 years. This funding source supports the planning efforts like this one, and SANDAG is fortunate to be in a successful application with the City of Vista and La Jolla Band of Los Seno Indians. They are currently working on their own local level safety plans. In addition to planning funds, the Safe Streets and Roads for All grant also includes implementation funds, but those are, there are significant requirements for those, and they need to be in a qualifying safety plan to meet those certain elements. The Regional Vision Zero Action Plan is meant to serve as that document for local jurisdictions. And local jurisdictions can point to this document and say that the project is located in this plan and then therefore qualifies for implementation dollars under the USDOT's Safe Streets and Roads for All grant. The updates that we have for you today really get into outreach and engagement and data analysis that our consultant team has begun. So on the public engagement updates, our team has been having ongoing public and engagement outreach. SANDAG did a series of outreach events throughout the region. And in addition to that, SANDAG also contracted with community-based organizations to get involved with their service areas with these similar efforts. We worked with the community-based organizations and the consultant team to create an engaging pop-up toolkit in which that the public was able to provide their input on preferences on moving around the San Diego region safely. The public was able to contribute their feedback with stickers. As you can see on the screen there, it was a nice tactile way for the public to get involved, and the kids really loved these stickers as well. This was a great way to get feedback from the community and also served as an educational opportunity for the community. In the winter, we wrapped up a digital engagement effort through SANDAG Safer Streets website, where there was an interactive map and the public was able to drop pins and comments where they felt a safety concern and where there may be gaps within our network. This was a successful tool and we nearly reached 3,000 comments, and we're currently analyzing all of that information. In addition to that, SANDAG CBO outreach, we have had quarterly technical advisory group meetings with various interdisciplinary backgrounds, and we also have had local agency project development team meetings where we met with staff from each of the local jurisdictions and talked through the plan in a more detailed level. We continued our engagements through our working groups. So this is our second round going to the working groups, and we are going to the policy advisory committees as well, and then ultimately wrapping up the plan's details. One of the first steps in setting up a safety program is gathering all the necessary data. In doing that, we worked with multiple divisions within SANDAG to create our traffic safety dashboard, and also worked with our external engagement with all of the jurisdictions, California Highway Patrol, and created this public-facing dashboard that has statewide integrated traffic reporting systems called SWITers, and the data is going back to 2006. The data we gathered is from anytime an officer responds to a crash on site, and we all travel throughout the region, so we wanted to share all of this data on a platform that's easily accessible and easy to digest. So on the screen there, you'll see a QR code that leads directly to the open data portal where the traffic safety dashboard lives. And then I will now pass it off to my colleague, Sam Sanford, to jump into the data elements.
Thank you. Okay, so building off what Jacqueline shared, that last bit, that was the first step in bringing together the data sets that we need to do a regional safety plan, a transportation safety plan. So we took those data and we really focused on data from 2018 to 2022 looking at crash data, but also looking at where crashes are occurring, what contributing factors were, the modes involved in different crashes, to understand essentially the distribution of crashes, where they're happening and how they're happening. So this illustration that's on the slide right now gives a few of the insights that came from this initial review. I don't want to go through all of them as we go through each of these little call out boxes, but a couple of them I do want to highlight. If we start at the bottom right, with 49% of fatal or serious injury crashes occur on roads with 4 or more lanes. So we're able to bring together information about the attributes or roadway features, along with the frequency or severity of crashes in that example. If we move to the left, 12% of bicycle crashes result in fatal or serious injury. So again, now we can bring in the mode aspect. So we looked at bicyclists, pedestrians, motorcycles, and motor vehicles separately and understand the distribution of crashes. Moving further left, pedestrians are involved in only 7% of all crashes, but 23% of fatal and serious injury crashes. So this again highlights the vulnerable users, as we all are pedestrians, as we move around the transportation system. Even if we do primarily drive a vehicle, we still do walk as we go from parking structures to our ultimate destinations. This is just an example of some of the data that we pulled earlier on in the process. And then this comes back into the development of 2 of the safety networks that we've developed to help guide advancements in safety in the region. So the 2 approaches, on the left-hand side, we have the regional safety focus network. This is looking at concentrations of high severity crashes throughout the transportation system. This is looking historically at crashes and where they have occurred. So that develops one network, and it is, again, looking at where things have happened in the past, which is a little bit of a limitation if you're only looking kind of in your rearview mirror. The other approach, the safety focus network, the systemic safety network on the right-hand side of the diagram, this one is more proactive. It's a risk-based assessment. Essentially, the project team looked at features that have a statistical correlation, a high correlation with those high severity crashes, and then looked for where those features exist in our transportation system. And I gave you an example on the prior slide of roadways with 4 or more lanes being kind of a higher risk. That one risk by itself wouldn't lead it to be on the systemic safety network. But if it has 5 or 6, up to 8 of those features, then it would show up on that safety focus network. So those are 2 approaches. The safety focus network is looking back at crash history. The systemic safety network is a risk-based to try and identify where crashes may occur in the future and get ahead of them before they occur. So first, taking a look at the safety focus network. This network, essentially, what we found is that 54% of all fatal and serious injury crashes occur on only 6% of the transportation network. So a large portion of our crashes occur on a very small portion of our transportation system. And this is extremely helpful and important because our network is over 10,000 miles. And so to try and get to something like 0 fatalities and zero serious injuries, that is a Herculean effort. And where do you even start? So this first data product helps us identify where to start. Okay, we're already down to this critical 6%, 653 miles. And within that, we see that 59% of all the pedestrian crashes are covered in that 6%, and 54% of the fatal and serious injury crashes involving cyclists are covered, and 49% of fatal and serious injury crashes involving senior or youth are covered. So if we look at this transportation system on a map, it's these black lines on the regional map. It's a large scale in order to see the entire region, but we see the lines contrast with the background there. And on the left-hand side, we have the statistics of what this network comprises. So it is 653 miles. Of that, 10,000 plus miles that we have in our region. This is non-freeway transportation system. So it does include highways, but if it's access controlled, it has ramps, then it's not included in this portion of the analysis. So what I'll go through in the next few slides are the 4 modes that I mentioned earlier. So we look at pedestrians, bicyclists, motorcycles, and motor vehicles. So starting off with pedestrians, and this is a kind of a gold yellow color. You can see mostly in the western portion of our county, along many of the cities, is kind of highlighted in this gold color. If I advance to the cyclist network, you'll see the network grow a little bit more. There's more, now we're looking at green lines, and we'll see green lines more along the coast and spread a little bit more inland, but still concentrating on the western third. If I move towards motorcycles, we see that the lines that denote where the safety focus network is goes across the entire region. So we're no longer limited to the western third, we're across the eastern 2/3 and mountainous areas as well. And then the last mode is the motor vehicle, which again is spread throughout the entire network. The very first map I showed you with the black lines, that was all 4 of those together. So compiled together. And so there are segments in our network that are a focus because of all 4 modes. Could be bicyclists, pedestrians, motorcycles, and motor vehicles. But there's other segments that might just be one mode that's a focus. So that's the historical piece. Now we'll look at the proactive systemic safety. So this one, again, is looking at features, attributes that we know have a correlation with high severity crashes. And then we're looking for where multiple features exist in one location. And so this spreads across the entire region. It covers every jurisdiction, where we see these tiny little squiggly lines on this region scale map, but it essentially is showing where these are. And so these 2 networks together, the idea is to share these with the jurisdictions, and therefore they can look through and identify projects of interest, priority locations that they can move forward on. So next steps, we are developing with the project team a safety improvements toolkit. So this is bringing together the data that we just spoke through on the traffic safety side. It's also bringing together the comments, the nearly 3,000 comments that Jacqueline mentioned, in addition to the outreach that the team and the CBOs have been working on, to get that into one tool that jurisdictions, owning agencies can access and pull together, so they can identify a location of interest, see what the public comments are about that location, and then ultimately what we call safety countermeasures, or essentially safety solutions. What types of features would help address the crashes that are occurring in that location? The plan itself is set to wrap up the early fall 2024, and then we immediately transition into implementation of the actions that come out of this. This is an action plan. It's meant to result in changes and additional work going forward. So once it's done, we will be transitioning into those steps. And that concludes our presentation. We're happy to take any comments or questions.
Are there any public comments on this item?
Thank you, Chair. There are no public comments.
Okay, now, I see Todd's. Todd, go ahead. David. Oh, David.
Are potholes included in this? On the roads? Maybe I'm not following this correctly, but potholes seem to be accident-prone things.
Yeah, so we don't have a data set that captures the pothole piece, but you're spot on that potholes can be something that contributes to a crash further
Yeah,
downstream.
that's what I'm getting at, I guess.
Yeah. Unfortunately, at this regional scale where we're bringing in the 18 cities, the county, and the tribes. We don't have a data set that gets to that to understand. There may be something within crash reports that denote that, but that would be up to the officer's discretion if they added anything. It's not something we've found yet that we've been able to tie into.
Guys ever deal with that? Potholes? Fixing them? Filling them in?
So I know each of our owning agencies does have a maintenance division that's working on that, and they kind of, depending on where you live, that owning agency has a different process for how they go about it, whether it can be local neighborhood residents reporting an issue, or they have a spot team that goes out and identifies them and then goes through that process. Each one's a little different.
All right, thanks.
Thank you, David, for your question. Any other questions? Oh, Wayne?
Yeah, I was just wondering, I'm just curious on like the draft summary statistics and things. How many cars and bicycles there are? How many different, it shows how many, like 12% of the accidents on bicycles, but I was wondering just how many bicycles there is compared to cars, or if there's any statistics on that.
Not that I have with me. I mean, we would have a population of essentially vehicles registered within the county. For bicycles, we wouldn't have any information on that since there's no registration system for it.
No estimates or anything?
But we have, we could look at the crash data to see the involvement. That's where we get most of, for this effort, it's been mostly through crash data. But we can get back to you on the vehicles.
I think even for the funding for bicycle lanes and everything else, it'd be very interesting to know if, how or I don't even know how you would estimate it, but if there is an estimation of how many people use bicycles or electric bikes as their mode of transportation.
I think we have, through the American Community Survey, which is run by Department of Census Bureau, excuse me, they have estimates on essentially commute work by different modes. And I believe for that, they do just a sampling survey. So that information we can pull, but it's not about it doesn't get into the number of bicycles. It can be essentially trips made by individuals on bicycles.
Yeah, that'd be.
Okay.
That'd be interesting. That'd be good. Thank you.
Sharon?
Yes, I have a question about, clearly from the statistics, you've got an issue with pedestrians and lighting. Is the lighting going to be addressed with your $1 billion, or is that in that individual community? How does that going to work out? And then your other issue is strongly El Cajon.
So on the lighting, that's definitely as far as identifying funding sources for lighting and lighting of different scales, right? So a lot of the lighting we currently have is vehicular focused. It's so drivers can see the roadways, but it's not necessarily for pedestrians to see, or maybe not even illuminating the pedestrian walkway. So that is one of the elements within the actions that we're drafting right now. And then we'll be passing that along to jurisdictions and helping support jurisdictions where possible on identifying funding to help with that. Potentially bring it into complete streets, making it really a complete street to have for all modes, and having that illumination for all modes as well. So the $1 billion a year that Jacqueline spoke to, that is the federal grant. That's essentially, it's a competitive grant. So we were successful in the very first round to get the award to develop this plan, and then we had to go after it again to do additional pieces. And that's, again, a competitive piece. So we will pull together applications and coordinate with other jurisdictions to support their applications. And then, it goes into that evaluation process to see where it goes.
Then one last clarification just for me. Pedestrian violation versus pedestrian right of way. So does that mean if I cross the street legally and I'm have a green light and everything, that's the right of way fatality that's happening to me? And if I violate it, how am I violating it?
Yeah, that's a really good question. So, and it's changing with new rules hitting the roads right now. So the data that we use to develop this plan will will need to be updated, and this plan will be updated. Right now, the course is to update it approximately with the regional plan update, so about every 4 years. And so the next cycle should have these new laws on pedestrian right-of-way inclusion. But to your point, your understanding is correct. Essentially, pedestrian right-of-way, the pedestrian was in the right-of-way, and when we're looking at the dashboard, for instance, and was struck, whereas pedestrian, either it's a failure to yield, crossing against the red, those would be more at an intersection or crossing mid-block prior to these new laws when it was not permissible. Yeah, so we'll have to fine tune that a little bit in the next cycle.
No more comments? So seeing no further comments, we can move to the next item. Thank you, Sam and Jacqueline, for this presentation. In our next item, item number 4, coordinated plan update. The staff will present an update on the coordinated plan development.
Good morning, everyone. My name is Ruby Morales, and I'm here to give an update on the coordinated plan. So first, a brief overview on the coordinated plan. So what is the coordinated plan? The coordinated plan provides a 5-year blueprint for how SANDAG will implement transit and social service transportation services in the San Diego region. The plan focuses on strategies to address the transportation needs for the region's older adults, people with disabilities, and people with limited means. The plan combines federal, state, and local requirements into a single document, and it includes all available transportation services. And the coordinated plan also guides 2 funding programs, the Transnet Senior Mini Grant and Section 5310 funds, which are grants that cover the urbanized area in the San Diego region. Elements of a plan include an inventory and assessment of all available services, assessment of transportation needs, and strategies to address the gaps and to achieve efficiencies in service delivery. The strategies included in the coordinated plan will be prioritized to receive funding through the Specialized Transportation Grant Program. So as mentioned in the previous slide, the coordinated plan facilitates the distribution of funding for our region's Specialized Transportation Grant Program, and eligibility for different fund types depend on the service area. So this program includes the federal Section 5310 program, which can fund services in the region's urbanized areas, which are the areas here in blue. Funding a portion for rural areas is administered by Caltrans, Division of Rail and Mass Transportation, and that will be the areas in white. The Specialized Transportation Grant Program also includes the local Transnet Senior Mini Grant Program, which can fund services across the entire region, inclusive of both rural and urban areas. So some of our next steps, this slide provides an overview of where we are now. And so over the next few months, we will begin data collection efforts. For this cycle, our project team is proposing to complement outreach efforts with a random sample survey. The survey will give SANDAG better insight into the travel behavior and needs of transportation disadvantaged population groups who may not be well represented in typical engagement efforts. The outreach will help us identify transportation needs, gaps, and strategies as well. And once we finalize our outreach plan, we will be able to share more details on that. And ultimately, we will release a draft plan followed by a comment period. So for more information on this effort, you can explore our webpage at sandag.org/coordinated plan, or you can feel free to reach out to me. My email is on the slide, ruby.morales@sandag.org, or you can also reach out to my colleague, Teen Garrett, who is part of the coordinated plan project team as well. But that concludes my brief update on the coordinated plan, and feel free to take any questions or comments.
Are there any public comments? Tessa?
Thank you, Chair. There are no public comments.
Are there any member comments or questions on this item? Please raise your hand. Go ahead.
Ruby, thanks for the presentation. I was curious, approximately, do you have a date of when the when the draft might be?
Yeah, so pending the waiver of the SANDAG Board Policy 18 that says that SANDAG must complete a coordinated plan every 4 years. And we're asking to waive that policy to give us a few extra months because we will be having a survey and that pushes our timeline a little bit. So pending approval of that waiver, we plan to have this plan in spring of 2025. So right after. Thank you.
Any other comments from our members? Seeing no further comments, we can move to the next item. Thank you, Ruby, so much for your presentation.
Thank you, everyone.
For item 5, we will hear from Christine Stenberg from Jewish Family Services and Marcy Roque from Travelers Aid with information about regional specialized transportation programs provided by their coalition.
Alex, really quickly before they start, Marcy and Christine, and I think a couple others had reached out to Zach and us to ask if they could present something on their services. And I think we all thought this was a great idea. So you will hear from them about their services. I think this kind of just helps all of us better understand the types of services that are out here in the region, where the gaps are. This kind of helps. I mean, all of our items, or a few of our items today, Ruby's item on the coordinate plan, our monthly, our standard item we have now about unmet needs, are all trying to understand what are our gaps, what's going on, and what we need to do to improve the services. So I appreciate you guys asking, and you're welcome here today. And if there's other agencies that would like to present at future meetings, more than happy to hear from anyone. I think this is a great chance to let all of us kind of know all the various services out there. So sorry for butting in, Alex, but thank you, ladies.
No problem. Good information to know.
Thank you, Brian.
Yeah, thank you for that introduction. It definitely ties together a lot of things that we've been discussing here, including Zach has come and talked about the various cycles that have started or ended and the criteria. So I'm Christine Stensberg. I'm the Senior Director of Nutrition and Aging with Jewish Family Service.
And I'm Marcy Roque, President and CEO of Travelers Aid Society of San Diego.
So we are here today to talk through, how do I hit the next slide? Big green button needed to be red to really call your attention. So about Jewish Family Service, we've actually been involved in the San Diego community for over 100 years. We are a highly responsive organization, so we take on really unmet needs and look for innovative ways to address that. We're person-centered and impact-driven, and our goal is to provide stability and self-sufficiency for individuals. We do everything from immigration support, refugee resettlement, family services, meeting basic needs, and having a very large and robust response for older adults with the focus to keep people in their homes aging with dignity. We've been an STAC member since 2021, but we were also on the organization before that.
Travelers Aid Society was established in 1901, so we are 123 years old. We have been serving San Diego's vulnerable populations for our entire history. We are currently offering 3 programs that assist low-income San Diegans with their transportation needs. Those programs include Senior Ride, Ride Finder, and Senior Solutions. We currently have over 1,600 active clients, and in 2023, we provided over 164,000 rides through a variety of services. We receive funding also from the City of San Diego, from the American Cancer Society, from the County of San Diego, private foundations, and we have semi-annual fundraising events. In addition to serving low-income older adults, we also have a small footprint where we service homeless individuals and families out of a satellite office at St. Vincent de Paul Village with a part-time case manager, and we also assist victims or survivors of domestic violence who need to flee town or receive services within town, actually.
So we're here today to talk about our two organizations, but also a coalition of specialized transportation providers. We are comprised of 5 organizations with over 255 years of experience, which is huge because we're really invested in the San Diego community. We'll walk through our services, but we are focused in on providing unmet needs and identifying the various ways that transportation is needed in our organization. There's no one size fits all to help everyone. Everyone has unique needs or unique challenges. And that's what we're here to really discuss, is why there's so many different organizations, but yet the need is continuing to outserve us, where we're hitting waiting lists and having more and more demands come our way. So in total, we've provided over 388,000 rides to 2,090 San Diegans just last year. And that is not even addressing every single person that's come to us, because we've had some waiting lists as well as needing to put caps on rides. As a coalition, we formed just this past year because we've realized that there's a lot of unmet need and coordination where we could actually help bring all of our services together and find innovative ways to work together.
So what is specialized transportation? You've heard about that in our last meeting from both Ali Vasquez and Zach Rivera, who presented on the Cycle 13 call for projects. But we thought it would be helpful to just redefine it again for you. Projects and programs that expand mobility for older adults and individuals with disabilities. And how that manifests itself in programs like ours and the other members of the coalition are basically in 2 categories: operating programs and, well, there's also capital programs, which we didn't list here, which include vans and other vehicles. But it involves operating programs like volunteer driver rides, group shuttles, rideshare rides, taxi vouchers, paratransit vouchers, bus passes, and private door-to-door rides. Within the category of mobility management, it includes travel training, individual trip training or transit training and trip planning, mobility and orientation training, and also information and referral services.
So we're going to talk about each of the 5 amazing organizations that are part of this coalition, starting out with Elder Help, who has over 50 years of experience serving older adults and has assisted over 260,000 older adults in the San Diegan community. They provide personalized service and information to help people remain in their homes and aging with dignity, and 2 specific transportation programs. There's Senior A-Go-Go, which provides curbside, door-to-door, and door-through toward transportation. And that's important because, as we discussed, each person has their own unique needs. For some people, they really need curb-to-curb, meaning that a vehicle can go to their curb and they can pick up. Other people need a more robust service, all the way from knocking on their door or going and helping them out of their home into transportation. For a lot of people, it's gaining access to medical appointments. Without that, would actually hurt their health on the long term or make them susceptible to going towards an assisted living earlier than intended. The Seniors A Go-Go program serves 360 seniors monthly with over 6,000 rides. In addition to that program, Elder Help provides transportation referrals and has over 800 calls relating to transportation. A little more about JFS's transportation program. We've been around for over 20 years providing transportation to older adults and providing over 500,000 rides. And that is huge. That's people getting to medical appointments, socialization. We provide programs and transportation in a variety of ways, including volunteer transportation, which we really look at as building the community. That's a neighbor providing transportation, and we're going above and beyond. It's transformable and not transactional. Staff drivers, and that's highly trained staff that are providing wheelchair transportation or for really vulnerable individuals, providing transportation that they wouldn't be able to use other services. We also provide shuttles and excursions. Excursions are group outings, and then on-demand transportation, where people can call us and we're able to dispatch a ride quickly, which really helps people that maybe had a sudden doctor's appointment that they were able to go to, or a socialization call. For us, we look at transportation as a critical component of keeping someone in their home, but we're finding that people need more and more wraparound services to successfully age in place. So for us, over 1/3 of people are enrolled in other services, and that's our meal delivery, that's our minor home repair, that's case management, or our corner market nutrition program. We have an amazing staff that gets to know our riders. And so when we have been working with someone and we find that their health might have changed, we go above and beyond in providing that referral to our internal programs or other programs, because for a lot of people, our on-the-go staff is their consistent person that they've been working with on a monthly basis to get to rides. And then we're able to find out any changes of health.
So a little bit more detail about Travelers Aid Society and our transportation programs. As I said, we have 3 main programs, but I think it's important to note too that for all of our programs, there are no fares. No one is charged anything. All of the services are 100% free. And all of our clients are either extremely low, very low, or low income. Most of them are actually extremely low income. So they really can't afford to pay any fares, but they still have needs to get to the doctor, to get to church, to get to the grocery store, the pharmacy, and that is where we step in. The Senior Ride program has been operating since about 2009. It's been primarily funded by SANDAG through the Specialized Transportation Grant Program. We have had a few other funding sources over the years that add to the program and enable us to provide more services. Just within Senior Ride, there are almost 165,000 rides per year. And we do that through bus passes, MTS Access, North County Transit District Lyft, Taxi Script. We have about 30 volunteer drivers, and we also use rideshare. There's 1,450 active clients, where there were in 2023. I think we actually have over 1,600 active clients now. As Christine said, resources are slim, and we've had to establish wait lists, and we've had to pause certain elements of our programs due to funding running out, or just the demand is greater than we even thought it would be when we did our applications, 18 months ago. Our Ride Finder program is a mobility management program. We provide information and referrals to other agencies when we can assist our clients. We're known in the community for this work, and so we get a lot of calls, over 31,000 calls a year, that we're telling people how they can navigate and how they can get around and whether or not we can help them and which other organizations might be able to help them, or just, providing a listening ear, which they often need. We provide referrals to other agencies. We do travel training, which means somebody needs to figure out how they're going to get back and forth to a doctor visit, and maybe they use the bus to get there, but on the way back, they need a taxi or a volunteer driver to bring them home. So we help them figure those things out. Our Senior Solutions program is primarily for immunocompromised older adults or individuals of any age that have a disability, for essential trips, for dialysis, for cancer treatments, for prescriptions and groceries. And that is a highly customized program that usually requires more assistance, and it provides approximately 8,800 rides in a year. Another organization in our coalition is the Peninsula Shepherd Center. It's been serving seniors in the Point Loma, Ocean Beach, and Midway districts since 1988. They also focus on filling gaps so that older adults can stay independent and healthy. They provide 4,500 rides to 100 riders within a year. They have a door-to-door volunteer service, volunteer driving service. They also have a shuttle van. I believe they have 3 vehicles, one of which is a wheelchair accessible vehicle. And they have excursions and programs that the seniors come and participate at the Peninsula Shepherd Center. The 5th organization in our coalition is St. Madeleine Sophie Center. They focus on educating and empowering individuals with intellectual and developmental disabilities to realize their full potential. They offer transportation for job training, volunteer opportunities, life skill training, recreational activities, arts and crafts education, and senior support services. They provide almost 177,000 one-way trips to over 400 clients per year. And they're one of the few programs in San Diego to have their own fleet of paratransit vehicles that transport these clients. Lack of transportation is a huge barrier for this population. Yeah. Go ahead.
So to piggyback off of the unmet needs discussion that we'll have and has been a theme in this council, we wanted to showcase the rising population of older adults. And this is something that is happening not only locally, but across California and across the world. So as you can see in this chart, we're over on the far side in 2024, but by 2060, the population will switch, where there'll be more older adults than children, and that's the first time in history that this will occur. What we're seeing on the front lines and providing these rides on a daily basis is really the beginning of that upward demand for services, where more and more older adults are aging in home, and that's where the majority of people want to remain, is in home as long as possible. But these support services are really vital to get people where they need to go, and transportation is one of the largest social determinants of health in terms of helping people get to where they need to go, like a medical appointment and access to nutritious food. So as a coalition, we've come together to really provide these innovative approaches. We are focused in on providing resources as wisely as possible. Our cost per ride is between $2.14 to $15.10, and that's through us really looking at innovative ways of providing transportation, from volunteers to community members to using vans and lifts as tactfully as possible to think through how there's really a reduction of downtime, and we're using that vehicle as wisely as possible. And then we're really focused in on the highest need. As Marcy talked about the low-income population, across our coalition, 92% of clients are low income, very low income, or extremely low income. We don't have charges or fares for services.
So that brings us to unmet needs in the region, which dovetails nicely with what we'll be discussing later on in the agenda here at SSTAC. As Christine mentioned, and I've mentioned, there is no one-stop solution for the challenge of specialized transportation in the county. The population is only growing. The demand is increasing. The resources are few, and there's frankly, there's not enough resource in the region for the need. And so as much as it's possible to advocate as a body, we would hope that STAC would help us advocate for bringing more funding into the region so that we can meet these needs. Between our 5 organizations, the entire county has coverage, and many clients use more than one of our services in order to have their needs met. We cross-refer frequently, and we created this coalition so that we'd have a better experience with referring clients and making sure that our clients have access to each other's services as well. The next cycle 13 of specialized grant funding, is approaching soon. I think it's opening in July. And there won't be enough funding to fund all the programs that apply with very good programs that serve all over the county. So we just want to bring that to everyone's attention as we approach the unmet needs portion of the agenda today. That's it for us in our presentation. We welcome any of you to email us or call us if you have further comment after the meeting. We can also provide you with the contact information for Elder Help, Peninsula Shepherd Center, and St. Madeleine Sophie Center if you wish. Thank you.
Are there any public comments, Tessa, for this comment item?
Thank you, Chair. I have 2 public comments, one in person. Dan Toten, please come to the podium.
Good morning. I had a couple of questions.
1 second, sir. Let us give you a. Thank you.
There we go. Good morning. I had a couple of questions. Being in a wheelchair myself, what part of the population are you guys serving that are in wheelchairs? Second of all, you say you're covering the whole county. Are you covering Fallbrook, Rainbow, Ramona Bonzel, East El Cajon, Alpine, East Lake, and Otay Ranch? Are you guys going that far out? And what percent of your vehicles are ADA compliant for wheelchairs? And what part of your population are in wheelchairs? And are these vehicles ADA compliant with CHP certification? Those are the questions that I have.
Thank you, sir. For public comments, we do not respond to questions from public comments, but I'm sure that the body will take your questions into account. I have one further public commenter on this item. Jean Durgan, please go ahead. You're self-muted.
Good morning. I'm Jean Durgan from the Peninsula Shepherd Center Board of Directors and a senior myself. Last week, I was at a program at the Shepherd Center Lounge when one of the other seniors came to me and said how much PSC's Out and About Senior Transportation Program meant to her. She is no longer driving and has no family close by. She wants to stay in her home for as long as possible. She uses the volunteer drivers to go to her doctor's appointment and uses the shuttle van program several times a week for grocery shopping, necessary errands, and attending senior lunches and activities and trips. So I just want to say how important these services are to the seniors throughout the entire county, and we must have funding to help them with that. Thank you so much for your time.
Thank you. And Chair, I have one other hand that was raised. Megan Schmidt, please go ahead.
Good morning, everyone. My name's Megan, and many of you remember me from back when I was chair of SSTAC, and it's great to be on this meeting. Sorry I couldn't be there in person today, but hope everyone's doing well. And I just wanted to kind of piggyback on some of the comments that have been made and add some more perspective. And one of those things is it's a great thing that there's the Access for All grant now that does specifically provide on-demand transportation for people who do require a wheelchair and mobility device. And another round of that funding will be coming out. And so it's wonderful that that additional funding has, been implemented to provide accessible trips. The other thing I wanted to mention is, like it was said previously, there is no one size fits all for the entire county. And although there are many agencies in the county, none of them go to all areas of the county at any given time. And I think that's important to clarify, whether it's a transit agency, whether it's FACT, or whether it's any of the coalition members, there is not enough service and efficiency of cost to be able to provide those services throughout the entire region. The coalition's members are definitely doing the best, with what they have. I know FACT also does what they can, but they are relying on providers to be available and vendors who are willing to go out to those regions. So when someone requests transportation in a rural area, there is no guarantee that they're going to get that service. And so I just wanted to provide that clarification and hope that at some point, someday we'll be able to get there. Thank you.
And that concludes the public comments.
Thank you, Megan. We missed you. So for this, for the public questions or comments, Christine or Marcy, would you like to answer any of those questions, or we just take note for the future?
I'm willing to address a couple of those. From Traveler's Aid, we do not own or operate any vehicles. All the transportation that we provide is by making arrangements with other providers to offer the rides. So we're limited on what we can offer by what's available in the region. So if somebody calls us from Fallbrook, we actually can help them because we have a partnership with the Foundation for Senior Care, and they have volunteer drivers, and we have an MOU with them. If somebody calls us in an area of the county where, a bus pass isn't suitable, or they're not enrolled in MTS Access or North County Transit District Lyft, if they have a volunteer driver, somebody in their life that can drive them, we will enroll them as a volunteer driver and we will pay them stipends. We can only offer wheelchair accessible trips when vehicles are available for us to book, and that is not always the case. There's a real shortage of those kinds of vehicles within the county. The AFA program seeks to solve that problem, but we're far from where we need to be in the region with wheelchair accessible vehicles.
Thank you, Marcy.
For Jewish Family Service, we do have a fleet of vehicles that are ADA. So they range from the full lifts or more of the vans. And that's really thanks to SANDAG funding to get those vehicles. And that's part of the capital grants. The AFA funding is huge and provides that on demand. And we're happy to provide those referrals, but we're definitely seeing an unmet need in wheelchair transportation. And it's just going to continue to increase as the population increases and mobility challenges continue.
Thank you. Any other member comments or questions? Okay. Seeing no further comment. Okay, I got okay. Marisa?
You want to go first?
Yeah, so I just had one question about
which of these programs, or if any of these programs, provide transportation to individuals who maybe have disabilities but are not seniors? If there's, I know one of them I had a question on was Ride Finder because I didn't see a specific age group. That was my only question.
Thank you. Yeah, a couple of things. So when we receive 5310 funding through SANDAG, that covers low-income older adults ages 65 and over, and it also covers individuals with disabilities of any age. So we will provide rides to someone who is under 65 if they have some form of disability, and they enroll in our program. We can do that through, we can certainly help them in our Ride Finder program, which is the mobility management program. And we can help them with our Senior Solutions program if they have, it gets complicated with the layers of the different funding, but if they have a disability and they're under 65, but they otherwise qualify for that program, which means that they're somehow immunocompromised, then we can provide rides for them. But within Ride Finder, people call us of all ages and income brackets, and we always give referrals and information. We don't take demographic information for people that are just calling for information. But if they need to enroll in a program and they really need transportation and they meet the age and income requirements, we'll either enroll them or directly refer them to another agency that can help them.
And then Todd?
Yeah, and I don't know if you can speak to this or not, Christine, but it seems like from my perspective, from what I've been hearing from some of our vendors, is
You
that
want to do your speaker? Turn it on.
A little closer.
is that
Thank you.
the insurance aspect, unfortunately, what we've heard or what I've heard, and I've never talked directly to the insurance agents to know this for a fact, but that if you operate a wheelchair-equipped vehicle, your insurance rates goes up dramatically. So unfortunately for us, what we've seen is a drop-off in vendors who want to serve people who use mobility devices. And unfortunately, I think that's probably going to take some kind of legislative action that where that would start, I don't know, but I'm just curious if you've seen or heard anything along that lines as well.
Yes. So we have definitely been hit with higher insurance rates. Everything is getting more expensive and we're feeling the squeeze, and especially the people that we are serving are. And the biggest thing is the funding isn't meeting all of the demands, especially as all of the costs continue to rise. But we count every time we have to use that lift for reporting, but then also making sure that we have everything as safe as possible.
And David, you had a question? No? Okay.
Hi there, my name's Adrienne. I'm also a traveler's aide. So I just wanted to add one more thing, Marissa. When we're looking at services for people who are not an older adult, but they do have different disabilities that they've been diagnosed with, Traveler's Aid does offer orientation and mobility training through the Ride Finder program. So that's where we have a orientation and mobility specialist that's contracted to go to their home if they are seeking to use public transit to remain independent. We do have someone that will go to their home, show them exactly how to use public transit, how to even get to that bus stop where it is in their neighborhood, and get them where they need to go. So it's a series of sessions where they do go in person. That's not only for older adults. We do have a very large visually impaired population that utilizes that services, but it's anyone with a disability as well.
And am I missing any raised hands? No. Okay. Seeing no further comment, we can move to the next item. Thank you, Christine and Mercy. That was a lot of information for us, and we appreciate you coming out and present. Item 6 is about SSTAC membership. Ashley will provide information on membership for the upcoming year. Thank you, Ashley.
Thank you, Chair Warner. We are coming up at the end of our membership year for SSTAC. As many of you As many of you probably know, you were appointed on a 3-year term for STAC. And this year we have 6 positions whose terms are expiring. Those terms that are expiring are Ted Kagan, he's a special interest member. Sharon Beckes, also special interest member. David Jackson, at-large member. Alex, at-large member. And then Traveler's Aid, and then the ARC of San Diego. Per the STAC charter, STAC members shall be chosen by a selection panel and shall serve a 3-year term beginning and ending in the month of July. At the end of their term, members may apply for another 3-year term. 3-year terms are staggered among selected members such that annually the terms of approximately 1/3 of the members expire. The membership application and selection process therefore occurs annually. A selection panel shall consist of SANDAG staff and no more than 3 current members of STAC whose membership position is not open up for application. The selection panel shall select members from a broad representation of social services agencies, transportation providers, and others representing the elderly, disabled, or persons of limited means, and strive to attain geographic and minority representation among members. We are looking to fill the positions that will be opening in July. The application period will be open from May 28th through June 28th, and the selection committee will then meet in the first half of July. The applications will be distributed to the current members, prospective members, and other specialized transportation stakeholders next week. Successful applicants will be announced at the July 16th STAC meeting and will take their seats at the following meeting scheduled in September. In September, we will also elect a new chair and vice chair. Are there any volunteers for the selection committee this year? Again, we need 3 current members who are not applying for reappointment this year to serve on the panel. Do we have any volunteers? I need 3 people. Wayne? Thank you. And if we don't have volunteers, I'll probably reach out, or Zach will reach out as well. Mary, I see you.
What is the time commitment? Like, when do you need to be available? for the
So
selection?
typically it's a meeting that you'll need to, we'll send out the applications you can review, and then we'll meet and discuss. So it's probably about an hour or 2 commitment total.
Oh, happy to volunteer.
Okay, perfect. Mary, I just need 1 more member. All right, Christine, perfect. All right, I'll have Zach reach out to you guys, and we'll, and he'll give you guys some specific dates and then when we'll be meeting. Awesome, thank you. And that is it. Thank you. Yeah, so we'll be sending out the application when it's on May 28th. That Zach will probably be sending it out to everyone. So he'll do it to the current members. So anyone who needs to reapply can reapply, as well as our distribution list that we have for STAC. Yes.
Thank you, Ashley. I'm going to reapply. Are there any public comments on this item?
There are no public comments on this item.
Are there any member comments? Are there any comments or questions from our members? No. I don't see it. Seeing no further comment, we can move to the next item. Thank you, Ashley. Item 7 is an information item with the updates from NTS, NCTD, and FACT. I'll let Ashley introduce the representatives from the operators. We will have the opportunity for members to comment on each update.
All right, so we can kick this update off. MTS, would you guys like to go first? Bree or Charles, do you have any updates today for us?
Yes, good morning. Charles Staple at MTS. So we're currently working with NCTD to ship the Sorrento Valley Coaster Connection service from MTS's scope of service to NCTD's. This change will go into effect June 10th. And detailed information, it can be found on NCTD's website.
Thank you. And then we can move over to NCTD. Mary?
Thank you to everyone who participated in Bike Anywhere Day last week. As Charles mentioned, June 10th is our upcoming service change. We'll be adopting the Sorrento Valley Coaster Connection bus service from MTS, plus adding a new route. And we are also launching our 1-year NCTD Plus microtransit pilot in San Marcos. For more information on these programs, please visit our website at gonctd.com. I'd like to remind everyone to take the coaster to Padres games. You may notice a beautiful Padres wrap on some of the trains. We hosted a Vista resource fair at Vista Transit Center to provide assistance to the unhoused community. The Delmar Bluffs restabilization continues, and NCTD has joined a pledge for anti-human trafficking on transit. And we've appointed Tom Tully as Chief Rail Operations Officer, Alex Dennis as Chief Procurement Officer, and Mary Dover as Chief of Staff. Thank you.
Thank you, Mary. All right, we'll move over to FACT. Sophia.
Thank you. We have one major notable activity going on at FACT, which is that in partnership with the City of Ramona, the Ramona Municipal Water District, FACT applied for and received the Community Resilience Centers grant through the state, which was a total of $10 million with a set aside for FACT to operate a shuttle service in Ramona. FACT does serve the whole county with both pre-scheduled and on-demand rides currently, but we are always looking for ways to augment that service in those rural areas, especially that are a little harder to reach, like Ramona. And so the grant is providing for 4 years of operation of an electric shuttle service. We're not expecting rollout until November for the service itself, but we are going to be starting in June or July with surveys and mapping and with speaking to people in the community for how we are going to operate this service. And the vehicles will be wheelchair accessible. And like I said, running for a total of 4 years. So that's the major update. We did also extend our Ride Fact Now on-demand rides for another month, but that service will be ending on June 15th. And then Ride Fact will be resuming right away on June 15th as well.
Thank you, Sophia. And that is it. Thank you, Chair.
Thank you, Ashley. Are there any public comments on this item?
Thank you. There are no public comments.
Are there any member comments on this item? Thank you, Chair.
Charles, I have a question for you. I know that NCTD, Mary's area, will be taking over the Sorrento Valley connection. Does that mean when I call for information about the scheduling, I will call NCTD directly?
Yes, that's correct.
Okay, that's one area. Thank you. Because I can use that. I live in downtown La Jolla, so it's really hard to have to go to Old Town to go back to North. So why not take the Sorrento Valley connection? And then the other question I have is on all the signs, the signs for the bus stops, that text number that's at the bottom no longer works. It's non-functioning. What are we doing about that? And then the other thing is one time we had a trial for using Wi-Fi on the buses. Where'd that go? So that's it.
Sharon's questions.
For NCTD, yes, you would contact our customer service line.
And I will have to get back with you about the Wi-Fi question.
Say that again, sir.
I'll have to get back to you about the Wi-Fi and the text.
And
So
then on the
I'll follow up
signs
with you.
where it has the text number,
Yes, I'll follow up
that's
with you.
belly up.
I'll follow up with you on that.
Yeah, great. Thanks. Thank you.
Thank you for the updates. We can move into our next item. Item 8 is a discussion item regarding unmet transit needs. Ashley will provide a brief update and then we can entertain discussion from the members and the public.
Thank you, Chair. We are continuing to take comments regarding our unmet needs item at each STAC meeting. During this item, we can take comments from working group members as well as the public on any additional unmet needs. Staff will direct comments to the appropriate contacts in various agencies for response and/or action. And I also wanted to let you guys know that at our next July meeting, we'll be having our annual public hearing. So we'll notice that as well and send that out to our large distribution list. And so it's our annual item. So we'll be taking that and submitting that to the state along with other comments that we've been getting all year long during this item 8 that we do. So thank you.
Are there any comments from the members, from the public first? Any public comments on this item?
There are no public comments.
Seeing no further public comments, are there any comments or questions from members regarding unmet transit needs? Okay. Thank you for all the discussion and comment. That was our last scheduled item for this meeting. Our next meeting will be on July 16 at 10 a.m. With that, are adjourned. Thank you all for coming and thank you, SANDAG, for doing all the presentations for the committee.